Welcome, everyone. Thank you for attending today's Amputee Coalition Winter Town Hall. We will get started momentarily. Thank you for joining us. Welcome, everyone. Thank you for joining the Amputee Coalition Winter Town Hall. My name is Patrice Deichel. I serve as the strategy executive to our president and CEO. I use she, her pronouns. I am an African-American woman with dark brown hair below my shoulders, and I'm wearing a purple dress and a big smile. We're excited to see you all tonight. I will be moderating tonight's session, starting with a few housekeeping notes. Before we begin, I'd like to take a moment to go over accessibility features available on Zoom to ensure everyone can fully participate. For those who prefer to read along, we also have a live transcript feature. You can access this by clicking on the live transcript button, which will display a running text of the entire conversation tonight. To enhance accessibility during our town hall, we have enabled closed captions and live translation. For our desktop and laptop users, you can click your CC closed caption button located on the Zoom toolbar on the bottom of the screen. You will then select Show Original Translation to view the options and captions directly on your screen. You may now need to select your caption language. For those who prefer to read along, we also have a live transcript feature. You can choose View Full Transcript to see the entire transcript in the side panel of the conversation. For mobile users, tap on the More option shown with the 3 dots in the meeting controls. Select Meeting Settings and hover over and click on the closed caption option to start this process. If you have any questions or need further assistance, please feel free to reach out during the meeting, and one of our Amputee Coalition staff will be happy to assist. The town hall events are regular occurrences, and we encourage you to join each session for the latest Amputee Coalition updates. Today, we are joined by our Amputee Coalition Board Chair, William Perno, and our President and CEO, Isidro, our Chief Strategy and Programs Officer, Ashlie White, and we're also joined with our senior leadership team members who will address and answer any questions from participants using the chat feature and the portion of our live questions when we get to that section. We will post several links, direct contacts, and resources in the chat, so please take time to reference and take for your future use. Only the presenters and the moderators tonight are unmuted. We will take questions and live questions for a portion of our time today. We ask guests to submit questions in advance of this event. We thank you for those that did so. We will be providing the most accurate, productive, and thoughtful responses. Some of these questions have been already answered in advance, and some will be answered tonight. During our Q&A, we will start with questions submitted in advance and then go into questions posted in the chat feature, then to our live questions. Please put all questions you would like answered in the Q&A and put your name in the chat if you would like to speak live. At the portion of live questions, we kindly do ask and request that you maintain a respectful and professional tone during the town hall. Any disrespectful language or profanity will result in immediate muting, and the remainder of your time will be forfeited. We welcome constructive questions and look forward to creating a positive and inclusive environment for everyone tonight. Thank you for respecting that. If you have any concerns, you can reach out to the Amputee Coalition staff through the chat by messaging the host or the panelists. For any questions during today's public forum, please use the Q&A feature. We will answer as many questions as possible during the allotted time. Zoom also offers screen reader support for those of you who use screen readers. Make sure your screen is enabled and the Zoom will work seamlessly with what you want to provide in the audio descriptions of the interface. Now, for anyone who needs to adjust the font size of the chat or captions, you can do this by going into your Zoom settings under subtitle settings on your desktop and accessibility under meeting settings on your mobile device. This allows you to customize the text size to your preference. If you're experiencing any technical difficulties, please let us know in the chat. One of the Amputee Coalition staff members will be in touch and will assist you. You can find that chat button, which looks like a word bubble, in the same menu bar. If you would like to turn the chat feature off, you can do so by pressing Alt+H and muting the notifications under chat options. We ask for your patience as we respond to technical issues. Now, at this time, it's my pleasure to introduce and turn things over for our opening remarks to the Amputee Coalition 2024 Board Chair, William Perno.
Thank you, Patrice. Oh, I appreciate your introductions this morning, this evening, excuse me, as well as all the instructions. I learn something new every time we have a town hall together, so thank you. Welcome to the Coalition's Winter Town Hall. This is an event of major communication that allows us to really stay connected to our community. And another purpose of these meetings is we want to be able to share important information and updates that you'll hear from our senior team this evening. So thank you for making time to join us live. And remember, the playback option is a perfect way to attend at a later time and watch this event in another moment. But I want to just say special thanks, the Amputee Coalition staff and the senior team, for not just working behind the scenes to ensure that all your questions are answered during the town hall, but there's also this question, why do we have a town hall? Some might ask. It's simple. The coalition cannot meet our vision of a world where our community thrives with equity and inclusion without being connected to its community. So as your 2024 board chair and coming into my 8th year of service with the coalition, I have known and experienced this vision is driving change in our community. A community represented by over 5.6 million people plus with limb loss and limb difference. Now, let's look back at 2024 as it comes to a close. Let's not forget the great year that we've had and celebrate a handful of successes about our mission in action. One of 5 things at top of my mind are: 1, our national conference in Atlanta back in August, incredible event. Our Patty Rossback Youth Camp back to a traditional camp setting this year. Number 3, a whole new cohort of certified peer visitors for 2024. Also, the Amputee Coalition was awarded the 2024 TSA Disability Multicultural Coalition Award. And finally, fresh off the presses, was a study from the U.S. Government Accountability Office proving that our advocacy is working and making a difference on a national level. Now, those are all great successes in 2024, but our success could not be possible without the critical partnerships that are central and essential to our mission. Our partners like Audubon, Hanger Clinic, a longtime supporter, Patty Rossback Youth Camp, OSER, another longtime supporter, Proteer, Intergrum, Alps, and so many more of our partners aligning with our mission, which all of them make it possible, and I thank each one of them. The last point I want to bring up this evening as we launch into our town hall is I'd like to close on this thought. Now, the success around the 2024 National Conference was really want to highlight our community support that we had for our scholarship fund. This fund allowed community members living with limb loss or limb difference to attend and not being held back from that unique and special experience due to financial circumstances was paramount this year. So I want to personally thank the community members who made that financial gift in 2024, allowing so many to experience conference. So in 2025, when conference registration opens, look for that scholarship application link because these opportunities will even be stronger in 2025. Now, community partnerships is how the Amputee Coalition will continue to thrive. And we thank all our supporters and individual donors across the country, the whole entire globe, and who have joined us tonight's town hall especially. So I thank you on behalf of the 2024 Board of Directors, which I serve. I now would like to introduce Amputee Coalition President and Chief Executive Officer, Cass Isidro.
Thank you, Bill, and thank you for your commitment and leadership. And we look forward to so much more in 2025. It's been terrific to work with you, and your longtime volunteer commitment to the organization is just paramount. My name is Isidro, and I use she, her pronouns. I have short, salt and pepper, white, whatever you call it, hair. I have on an orange sweater today and a green shirt in the AC colors tonight. Greetings, advocates, family members, caregivers, supporters, board members, and most importantly, friends of the Amputee Coalition. It is so great to have you join us this evening, and to the many others that will watch this video recording as we share it later. We appreciate your time showing up, and we know that together in community, showing up and taking action is how we move all of our programs, services, and advocacy forward. Many of you have continued to show up for the organization. You've shared your experiences on our platforms, and you have stood by our side as we've taken the lead. And it's because of your trust and willingness to share and your ideas that have fueled our day-to-day work. Our work to support, educate, and advocate for the limb loss and limb difference community. And together, I am so happy to say, as we close out this year, we are back and we are gaining momentum. And with that, I want to introduce you to our senior team, who I'm so proud to join with daily in the work. They'll be answering some of the questions that we'll come to later, and they really exemplify what it means to continue to be committed to vision through the hard work every day. We've had to make difficult choices. We've had to make changes. We've had to start things anew. And this team has kept the vision in mind as they've done this day to day. So if you'll just wave and smile when I announce your name, and then later everyone will speak in answering questions. Maurice Henson, who is our Director of Youth and Workforce Development. Maurice, thank you. Lucas DeLuca, our Director of Education and Resources. I feel like you should be tipping your hat there, Lucas. Shri Thaker, our Director of Communications and Partnerships. Whitney Doyle, in a new position as our Director of Operations and Capacity Building. Patrice Deichel, Strategy Executive in the Executive Office with me. Ashlie White will be coming in a minute. Ashlie, you want to say hello? There you go. And we also have a new staff member who has literally hit the ground running, is en route to DC for a meeting tomorrow. Nicole Verkeilen is our new Director of Impact Campaigns and the lead for the So Everybody Can Move initiative. So we all welcome you here tonight. As you've heard me say before, as an organization, we aim to serve more, and we aim to do better and lean into partnerships to allow us to do this. Bill talked about the vision and the leadership that the board has put forward for the organization. And tonight, I want to take you through some of the day by day. I want to bring numbers in front of you that let you know how things are going, how many people we're serving. Because day to day, we continue to execute the work of supporting community in advocating, educating, and representing more than 5 million people living with limb loss and limb difference. A core area of our work is in implementing the National Limb Loss Resource Center. And our information and referral team has received 6,544 cases from January to the end of October this year, averaging more than 30 cases per workday, consistently over and over, week after week. These numbers also do not include the engagement on our social channels. And those of you who have been on AC Connect or have been on Instagram, you know those are quite chatty places, or direct contacts with our advocacy team members. From January to date, we have matched 926 people for peer visits. And that's just the initial match. Many of you know these relationships go on for years. And we've added 6,600 people to our database. These are folks who've signed up for newsletters, who've signed up for InMotion, who've had a contact with us and joined community. Our team is working hard for community members, families, caregivers, and healthcare professionals, ensuring no one faces their journey alone, creating and delivering vital resources and support, which often include providing information, fact sheets, referrals, patient navigation, which can go on for days, sometimes weeks, peer visits, support groups, and so much more. In our support services, as was mentioned a little bit earlier, we've actually trained 251 new certified peer visitors this year. I can imagine if we were in person, we would hear this little applause echoing because people get so excited about that. And we recertified 250 peer visitor volunteers. And next week, we have a training in California where we will actually reinforce that by training 9 more certified peer visitor trainers. So these are the folks that actually train the people that get the work done. Our recurring virtual support groups are another foundation of the organization and are really the lifeblood of connection day in and day out. The virtual support groups meet on the first, second, third, fourth Thursday of each month in their respective time zones, as well as our caregiver support group, our Black, Indigenous, People of Color support group, and our young adult support group. We also provide support to more than 200 support groups across the nation, giving them advice, resources, and helping ensure that they can continue in their mission as well. In 2024, our hospital partnerships grew to 155 partners, and we added 23 just this year alone. We also welcome, I see Whitney smiling, I think she knows what's next, 48 new certified lead advocates through 2 training courses that were created and delivered this year. And finally, in the workforce development program, we have 130 adults, veterans, and youth ages 15 to 17 registered for the program. Exciting as well that our youth are building their own programs. The Amputee Coalition Youth Leadership Council is currently working on their youth-led annual service project. They are working in Ohio, Texas, and New Hampshire as advocates to elevate youth voices and so everybody can move. And they're also organizing, recruiting, and mobilizing other youth to get involved in recycling of durable medical equipment with ROPS components for a cause initiative. So here's to giving the youth something to do and connect with each other. As you can appreciate, 2024 has been a busy year. And this is a reminder not only of what we're doing, but in the impact that all of you have in helping us connect to others in sharing resources and telling people about the programs and services. There's many opportunities to join any of these support groups, to connect with resources, to join town halls, and get more things to more people. I sincerely thank our senior team, our entire staff, our volunteers for their energy, their motivation, and their commitment to bringing the Amputee Coalition back. We're also coming off, Bill mentioned our success of our annual conference where we had more than 700 people in attendance. And nearly 50% of those for the second year in a row were attending the event for the first time. I think one of the most exciting things about the event is knowing that 80% of the people who were there said that it changed their life. It gave them a feeling of being included, and it gave them an awareness of the community to which they belong. The conference highlights, as many of you know, included our clinics, our programming sessions, amazing keynotes. And I know there are at least 3 of you who submitted questions tonight that are asking about the next conference. So I will just tackle that now. Yes, we are trying to keep the conference super affordable. Yes, we are committed to trying to move it across the nation. And yes, we will be announcing not tonight, but very soon when the next conference is. We intentionally stepped back and tried to take a different look at this conference in trying to make it more affordable and ensuring we checked all the boxes for accessibility that are so important at the hotel and the city. And we intentionally looked at the best locations to get in and out of. That's taking a little bit longer, but we hope within the next 60 days to have an announcement for where the next conference is, and you can start planning those dates. I've shared many updates and highlights on our programs and how we serve and advocate. And as many of you know, the National Limb Loss Resource Center is the centerpiece of our Amputee Coalition's work. Through the Department of Health and Human Services and the Administration for Community Living, we are funded to provide some of those services. But our funding, the need for the services extend way beyond what that funding actually provides. And we still deliver resources day in and day out with donations and other support that we can put together. All of our activities and the need extend far beyond. And as we close out 2024, I'd be remiss if I didn't give all of you an opportunity to support the work of the Amputee Coalition. You can give a meaningful gift by visiting our website. There's a donation button. You can contact me directly if you want to talk about special ideas, matching gifts, plan giving, any of the things. But we're really looking to expand programs and services and supports, and we need your help to do that. Before I turn things over, I want to express my deepest gratitude for all of you in continuing to support and uphold the mission in the organization. There have been more than a few conversations where you've told me what we've did wrong, you've shared where we could do better, and we continue to step forward every day to do that, and this is the team doing it. For now, I'm going to introduce Ashlie White, our Chief Strategy and Programs Officer, and Ashlie is going to dig into a little bit deeper on some of the highlights in our programs. Ashlie, over to you.
Thank you so much, Cass. Hi, I'm Ashlie White. I'm the Chief Strategy and Programs Officer. I'm a white woman with strawberry blonde hair, not real. That is in our Amputee Coalition headquarters office here in Washington, D.C. And I'm excited to be able to share some details about the GAO report, the Government Accountability Office report that Bill mentioned in his introduction tonight. Cass shared a lot of great numbers about all the services and supports that the Amputee Coalition has the opportunity to provide members of the limb loss and limb difference community. And the reality is the reason that the need is still not met is because unfortunately, there are systems in place that provide care to individuals who experience an amputation or those who are born with limb differences that operate through government entities, and those government entities that oversee health systems have a responsibility to report on how well they do their work. So the Government Accountability Office looks at systems across the US and says, hey, are our government organizations doing well at what they at the services that they provide to American citizens? And that's what the Government Accountability Office is responsible for doing. So the way that the report that we just shared with the community through our various communications channels came to be was actually through a piece of legislation that was introduced back in the 116th Congress. So every Congress is numbered, where we're currently in the 118th, about to go in the 119th. So every Congress is 2 years. So back in the 116th Congress, we had some champions on Capitol Hill that said, we really want to look at how government payers, so Medicare and Medicaid and the VA and DOD, that are responsible for providing health care to individuals who have limb loss or limb difference, how they're doing. You know, are they providing good support services, or is there a good continuum of care? Do people get rehabilitation? That's what the requesters, so our champions in Congress, wanted to see information on, and they introduced a piece of legislation called the AAA Study Act. So I know that many of you who have been following us for years and been in the community for a while, you've heard us talk about the AAA Study Act. That was the genesis of this GAO report. Fast forward 2 Congresses later, Senator Tammy Duckworth, Senator Marsha Blackburn, as well as Senator Casey, and Congress members at the time, Butterfield, who's no longer in Congress, but has always been a fantastic supporter of our organization, as well as Congressman Brett Guthrie. They all came together and put a request letter to the GAO to have this report created. And that was really to look at the health care that's provided to individuals who have amputations or who are born with limb differences in the US. Now, what this report says, what it really says is, what does it look like for a person who has amputation who's on Medicare? That's what came out. So, you know, it doesn't say all the things that we hoped to see in the legislation or in the formal request, but it does do an incredible job at looking at how Medicare provides services to individuals who have amputations in the system. And the reason that that's so important is because it highlights some significant challenges, some positives as well, but it looks at, you know, where an individual may not receive all of the services that they need to live a healthy life after an amputation. And some of those statistics can seem scary. So I will say up front that it's really important for you to take it into the context that this is Medicare and this is healthcare data, claims analysis. But one of the most striking data points in this survey is that in 2016, for all Medicare beneficiaries who received an amputation, by 2019, 61% of them had died. And I think, that's such a stark data point, statistic, but it represents a community of individuals that have challenging healthcare conditions and need support services. So if you want to look at anything that we do at this organization and the value that it has, it's the opportunity to provide support services through that journey, in that journey. So if 61% of those individuals passed away before 2019, what we know is that they may not have been receiving the coordinated care that we hope that everyone who has an amputation in the United States receives. And so this is why it matters, right? Understanding the data points that are in this report will help us as an organization understand how to position ourselves in terms of policy, healthcare policy, as well as other opportunities. The report also shared some disparities, like the fact that only 30% of Medicare beneficiaries who receive amputations receive prosthetic care. It also pointed to some race, rurality, and regionality disparities. We already know that individuals who are Black receive amputations at higher rates than individuals who are white for any reason. We also know that in rural America, so 20% of Medicare beneficiaries live in rural America, but 28% of the people who had amputations were in rural America. That 8% discrepancy is something that we really should be looking at. Is it because they don't have enough healthcare access pre-amputation? What happens after they receive their amputation? Do they have enough access to rehabilitation and services that will help them regain function and mobility in their lives? So these data points really do matter, and we hope that you will take this journey with us as we begin our advocacy efforts around some health policy initiatives associated with what we learned in this GAO report, and know that we take the responsibility we have very seriously to be the organization that's out there and fighting for better for you all. So thank you so much for the opportunity to do that work. And if you have any questions, we'll be sharing lots of, we'll have blog posts, we'll have some engagement sessions coming up, opportunities for us to answer more questions. Happy to answer as many of them today as we can. On a super positive note, we do have a really fun update about the National Limb Loss Resource Center and what we call community connections. This is our database, zip code database search feature on our website. It allows you to look for all of the resources that are within a certain distance within your own community, including now your support groups. So support groups are finally migrated in to the resource database. This also has a back-end feature that allows us to coordinate, in real time with those support groups to add some additional information to their profiles so you can learn as much as possible, like if they have virtual meetings or if they have in-person meetings, and those types of things. So it's a really great addition to our community connections, and more updates to come in the future for that feature. And also, we heard you all. You asked that we return a physical presence back into the community, into those regional locations where you may all remember we used to have limb loss and limb difference education days. And we heard you, and we are bringing them back. And they have a new brand. So we are announcing our return to Limb Loss and Limb Difference Education Days as the Amputee Coalition's Community Days. And we're very excited for the first quarter of 2024 to have to be having those in Memphis and the Mississippi Delta. You'll see announcements about these next week. And also, along with this relaunch of our Community Day events, our regional and in-community events, we'll be publishing an RFP. This is a request for proposals. That RFP will include several features, and I know that we'll be talking a little bit more in detail, but when we announce these days, you'll see that you can say, okay, you know what? I really want the Amputee Coalition to come to my community and put a community day on in my neighborhood. And I have this robust support group, and we all want to come together and we want to have one of these events in our community. There is a request form as that's part of this RFP that allows you to say, all right, AC, come to my community, like do one of these community days in my hometown. So we're very excited that that will be part of the request proposal process. Also, we will be asking you for nominations for speakers and for like keynote speakers or session speakers. And also, this is an opportunity for you to submit proposals about educational opportunities for any event, whether that's national conference or whether that's our community days or just a webinar but a webinar that you want to bring to the community. Those opportunities will all be included in that RFP process. So we're very excited about the return of our community days and the opportunities for you all to get engaged early in the planning process. And then Bill mentioned this Disability and Multicultural Coalition Community Partnership Award. That's a mouthful, but I wanted to give a little more detail about that because there's some team members on this screen that I really want to share celebration with. A few months back, there was a conference and everyone was leaving the conference. Many members of the community were part of this event and they were headed through the airport, and there were some unfortunate experiences with TSA at this airport. And as a result of that, we saw a huge sort of outreach to us. I mean, we were receiving messages in real time, messages the next day, and they were saying, like, we have to do something about this. The community came together and they asked the Amputee Coalition to step in and do something about it. And in response to that, Whitney Doyle and Shree Thaker jumped in and said, all right, let's do this. We're going to hold a town hall, a public forum where we invite individuals from the community to share their experiences with TSA. And we invited TSA. We actually had 7 members from the TSA team. We had people from Homeland Security. We had Hill staffers from congressional offices who were all on that public forum, live public forum call. And as a result of that, the Amputee Coalition was recognized for that effort and received the Disability and Multicultural Coalition Community Partnership Award from the TSA, which Shree is holding up right now. And the reality is, like, we just stepped in and did what you all asked us to do. And I'm not saying that we wouldn't have done it, you know, if you hadn't have spoken up, but it is your voices that led the charge. It is your experiences and sharing those experiences with us that allowed us to coordinate all of the right people to come together to hear the experiences that you all have traveling through airports every day. So please continue to do that. Call on us when it's time to step up and make a stink every now and then, because sometimes those outspoken voices are the ones that lead to really great partnerships and opportunities for improvements in our community. So thank you so much. And I will kick it back over to Patrice.
Thank you, Ashlie. Thank you, Bill and Cass, as well, for your updates. We are now going to go to our community questions that we received before tonight's session. Just as a reminder, if you'd like to ask a question live, please do let our team members know in the chat. We will add you to the list and prompt you when you are next in line. Our first community question, we're actually going to kick this back to Ashlie. The question asks, will you please touch upon above-the-knee osseointegration current status and utilization?
Thank you for the question, Patrice, and to the community member who asked it. So, you know, this is an interesting and innovative space, and we're excited to see how many members of the community are engaging with us on osseointegration. Currently, there is only one approved osseointegration device. The OPRA system is approved through the FDA, but there are ongoing research studies as well that are happening in hospitals across the U.S. and within research institutions across the U.S. And so there are different types of osseointegration surgeries that you will hear about, and different individuals may share their specific type of osseointegration surgery. But at present, there is only one FDA approved for the market osseointegration system, and that's the OPRA system.
Thank you, Ashlie. Our next question says, when planning for the next few national conferences, can it be moved around the country? Thank you in advance.
Yes. That's it. Yes, we're trying to move it around. We have no desire to stay in one place. We want many people to access the conference as possible.
Perfect. This question came in the chat. Medicare eligibility is limited to those 65 or older, or those who qualify for disability insurance benefits through SSA. It is a small cross-section. Should we expect a similar report for Medicaid and or expanded Medicaid?
Fantastic question. So they did take some effort to look at the Medicaid population. They shared information about individuals born with limb differences in the report, but it was more of like a snapshot of how Medicaid works and how individuals access Medicaid benefits through the system, as opposed to actually looking at the type in full scope, the type of coverage or that they have through those entities. And that's primarily because there are so many state specific options there. So the states have some autonomy in the way that they manage their Medicaid programs. And any of those of you who know, who have used Medicaid coverage will know that every state is different, and that there is from year to year even some variation in what can be covered. And so what we are hopeful to see is a recognition that these systems actually like work together. If a person is on disability, they may actually be dually eligible. So they may be a Medicare, Medicaid, have Medicare and Medicaid coverage. And they made a note in the report about that population as well, and highlighted the percentages of those who utilize both Medicare and Medicaid. I don't anticipate seeing a similar report to this in a holistic way, but as we continue to work on some of our insurance coverage issues in each state, certainly through the So Everybody Can Move effort, you will start to see reports come out about Medicaid coverage, because in fact, some Medicaids in states are actually starting to cover activity-specific prostheses. So we're seeing some tremendous activity at the state level, and I only expect that to lend opportunity to get additional data from the states directly.
Good things. Okay, our next question says, this is a concrete suggestion for work and volunteer opportunities that make use of my background to assist amputees.
Great question. Thank you for that question. I would say the first entry point, probably the most important one, is to become a workforce development volunteer through our workforce development program. You're able to utilize those skills if you're looking to reentry to work, if you're looking to just enter the workforce for the first time. I mean, there's 7 different training sessions you can take part in. There's the one-on-one planning meeting that you and our program manager, Trinea Reed, have. And then really just working on, professional resume creation. On the volunteer side, if you're looking just to volunteer, getting involved as a workforce development volunteer will definitely be an avenue to pursue in order to get involved with like our Amputee Coalition Workforce Development Employment Council. Our Workforce Development Employment Council is made up of 21 Fortune 100, 500 companies, colleges, universities, organizations, and businesses to really continue to keep the conversation about disability awareness in the workplace and hiring practices in the workplace at the forefront of the conversation. So I would say on the work side of things, just really going through the workforce development program on a volunteerism side, really go get involved in our workforce development volunteerism would be a great avenue.
Lots of opportunities. All right. This next community member says, I'm in Alabama, sorry, and working on prosthetic and orthotics parity legislation. I need ideas on forming an AL coalition.
Well, thank you first for wanting to be engaged in prosthetic and orthotic access in your state. That is the first step. So you're already over the hard part. You want to act, right? You want to do something. Thank you so much. I really do wish Nicole was on tonight because not only does the So Everybody Can Move movement expand access to physical activity, but most of the legislation in states that's been introduced where there wasn't already a parity law or an insurance fairness law has included the full scope of orthotic and prosthetic coverage. So our So Everybody Can Move movement is absolutely increasing access to prosthetic and orthotic care. If your state is one of the states that is reluctant or concerned about introducing a So Everybody Can Move law right now, and you really want to just look at prosthetic and orthotic access, that doesn't change the fact that that your coalitions are already being gathering together in this So Everybody Can Move movement. And I guarantee you there is somebody from Alabama that we will be able to introduce you to tomorrow. So if you want to share your information with us, please feel free to email advocacy@amputee-coalition.org, and we will get you connected to the other advocates. Additionally, Whitney just finished, as was shared earlier, training 40 new certified lead advocates, and each of them are, tackling these same challenges in their communities. And so we would encourage you to continue to engage with us in all advocacy opportunities at the organization, because you'll continue to meet people there as well.
Thank you, Ashlie. Our next question, what volunteer training opportunities are there for 2025?
Trace, this is Whitney. I'm going to take that question. In my role as Director of Operations and Capacity Building, I get to oversee our volunteer management services. With that crew that comes with our peer support team, as well as our lead advocates, all of our certification trainings. And I apologize if I'm a little laggy. My computer, it's after 5 o'clock. It's ready to be done today. So we just wrapped up a lead advocate certification training in 2025. We are slated to do a year again. So one will be and one will be in the fall, September, October timeframe, maybe even August, but those dates will be published and we have them confirmed. The lead advocate training is a online virtual training. And then our other certified volunteer trainings that are coming are our peer visitors. So to become a certified peer visitor, it is in versions of that training. So we're very excited to say that those two in January and February will each have a peer visitor certification training component. We also always have one tied to our national conference, so you can become a certified peer visitor there. We also have them online. So currently you go online and you fill out the application to become a certified peer visitor, and we will add you to the list and let you know when the next training will be. Typically they are 4 hours and 4 hours online. We will be posting dates in the next, before the end of the calendar year for 2025 for those set virtual events for certified peer visitors. And let's see, what else? And that training will be coming to AC Learn, which is our online learning management system. So right now it's a live virtual training, but it will become one where you can do part of it at your own pace on AC Learn, which is our online learning management software, which is really exciting. So if you have absolutely any interest in becoming either a certified peer visitor or a certified lead advocate, please reach out. I will drop the emails in the chat if they're not already being dropped already. Oh, looks like they are. So please reach out. We definitely want to engage as many as people as possible. I see some of our new certified lead advocates as attendees today. So shout out to, oh my gosh, Karen and Sean and Scott. I know, Bill, we talked about we had no certified lead advocates in West Virginia, and Scott is on the call, and he is our new certified lead advocate in West Virginia. And in March, we didn't have any in Delaware, and Sean is on the call, and he's in Delaware. So we are really having some wonderful, incredible people becoming certified lead advocates for the MPT Coalition. So please reach out. We'd love to get you trained up to go and spread the word and do good work.
Thank you, Whitney. Next question. How are decisions made on which topics and speakers are chosen for conferences? Would there be smaller and more individualized opportunities?
Thanks, Patrice. If it's all right, I'll take that one. And also, I think there was a question about how do I request a community day in my town? And I feel like all of those kind of just go together. So I'm going to try to tackle them all at once. What I'm excited to say is that the requesting of a community day, the request for proposals, and the nominations for speakers, if you know someone would be a great speaker, all three of those forms are going to be coming out next week. And I am looking to have a webinar in the second week of December, sometime around there, to walk everybody through this process on if I want to go through the form, what do I need to fill out? If I want to be a presenter, but maybe I'm not confident yet, can you help me with that? Or what topic should I look at speaking about that I'm passionate about? All of those things I'd love to do. I want to take a moment to say that we're looking for exciting disability content, exciting speakers, and just reaching out to the community and really just empowering all of you to express interest in doing these things. So what I will say, if you're interested in a community day, that second part of that question, please reach out, fill out the form. Same with being a presenter or with nominating someone who you know is going to be an amazing speaker. All of those are great. When it comes to the decisions that we make on the topics and the speakers for conferences, it really boils down to a few different, I would think, pieces. So the first is the number of sessions. So we only have so many hours in a day. So this last conference, I think we had 25 educational sessions. We had room for maybe 5 different clinics. And so we start there and then we go, okay, what are our educational pathways? And we look at community living, health and wellness, things of that nature. And we start to grow out from there. What's going to be the best space to have the most diverse program around? So that's just how we get the ball rolling. We do have a kind of an assessment sheet. And we look at that. It looks at things like how relevant is the topic that somebody's presenting on? How applicable is it to our community? What is the individual's background? What experience do they have? We also look at, like, if you're a member of the community and what that plays into in sharing your experience and how relevant that is. We always think that's so powerful. And so all of that comes into play. And we also lean on the backs and the minds of our science and medical advisory committee. We've got an incredible group of really smart people who really get to provide feedback, thoughts, and direction sometimes if we need it in regards to how presentations and how topics can be grown and expanded to really affect and really inspire more people around the topics that are being presented on. So that's a little bit about how we make those decisions. I am really excited to be hosting that webinar in December. I hope many of you will drop in. If you have people who want to present, please, please, please let them know that this is happening. We're really looking forward to finding amazing presenters to hit on those community days, to come out to conference, and to do anything in between. I'm looking forward to hosting more webinars. And so if you have a passion, but maybe don't want to travel, you can do it from your home, and we'd love to have you. So that's all I'll share today in regards to conference and community days. I hope that was helpful.
Thank you, Lucas. Our next question, how do I, as a member, help support and spread the word in my community?
Hey, I'll take this question. I'm Shri, the Director of Communications Partnerships. I use she, her pronouns. And I've got a light blue sweater on with some very colorful toucans and a black and white wallpaper behind me. I share all that because we need some fun. So there's a few links that I'll drop into the chat in a second, but the best ways of sharing the word will always be through social media on any and all platforms that you may be active on. AC Connect, as it's a wonderful space to continue spreading the message amongst our community itself, which also includes the support members of our world, such as family, caregivers, and of course, clinicians, providers, et cetera, as well, kind of as that community develops. And of course, it's through getting involved in reading the materials and sharing your stories as well. So that would be for In Motion, the magazine that publishes 6 times a year, and the Thrive blog, as well as Thrive newsletter, which comes out every week. So there's a couple different ways in communicating amongst the community, and then it would be through programs like becoming a CLA, so certified lead advocate, and signing up for being an advocate and getting involved with your legislators and sharing your story and advocating for what the needs are. So I'll be dropping a bunch of those links into the chat. And if you have any additional questions, let us know.
Thank you, Shri. All right, our next question, can I request my state's proclamation yet?
Absolutely. Not all of them, but a lot of them you can. The best way to know, I mean, you can actually just Google your state name and proclamation and should pop up some information about your timelines. I know I'm from North Carolina. The process for North Carolina is already underway and due in November, actually. So you have to get those requests in early in the state of North Carolina. Our team member, Ryan Getty, who many of you know, he is overseeing our efforts to collect as many state proclamations as possible this year. We want to beat the number that we got last year. So we're competing with ourselves a little bit here. So we're hoping the community will come along and join us in that effort. Many state proclamation request lines are open currently, but every state has a different date. So please look it up for your individual state or reach out to Ryan Getty or to our advocacy team.
Thank you, Ashlie. Next question, how can we become trained in the workforce volunteer section? And when can we expect the 2025 Patty Rosbach YEP Youth Camp information to be released?
Yeah, if you go to the Amputee Coalition website and go to the workforce development section webpage, you can register for workforce development updates. And then Trinea Reed, our program manager of the workforce development, will contact you and set up a one-on-one, and then you can then set up a training to become trained to be a workforce development volunteer and get any other workforce development support you will need. The Patty Rosbach YEP Youth Camp information will be released and ready the week of November 25th. You can expect a flyer, registration information, not only for campers, for our leaders in training, and our camp counselors. So I'm really excited. We'll be back in Rockport, Texas at Camp Aranzazu, July 27th through August 1. And so really excited about that. Really excited again to be back in a traditional camp style setting, and really look forward to having our community members take part in that initiative.
Thank you. Next question, are there presently any new bills being looked at by Congress for amputees?
It's a great question. There are several pieces of legislation. They're not new. Many of you have heard us talk about them, but that directly impact the lives of individuals living with limb loss or limb difference. You may recall the OMP, the Orthotic and Prosthetic Patient-Centered Care Act. That is a piece of legislation, bilateral, bicameral, bipartisan legislation that's being led by our partners over at the American Orthotic and Prosthetic Association. That legislation is still active in Congress, but the reality is that as we speed very quickly into the end of this congressional session, we have a new Congress starting in January. The what we will likely see move at the end of the year is a skinny healthcare package that has a amalgamation of different pieces of legislation together that may pass towards the end of the year. And it's always very hard to get your items onto that bill. We had several pieces of legislation that we've supported throughout this Congress over the past 2 years, including the ARC Act, which is for peripheral arterial disease screenings. We've weighed in on the Restore Act, which is access to dialysis treatments for individuals. We've weighed in on TROA, which is about weight bias and obesity care access. And we've weighed in on protecting the innovation pipeline for genetically targeted technologies. But those are all pieces of legislation that include things that are relevant and important to this community, but also impact broader communities as well. So it's hard to prognosticate whether any of those pieces will move. We certainly hope so, and we'll continue to add our voices to the conversation. But there have been no new pieces of legislation introduced. Stay tuned for 2025 when we will absolutely be introducing new legislation.
Exciting. Thank you, Ashlie. How do I request a community day in my town?
I think we tackled this one in with the other one, but it was just about finding those forms when they come out next week, making sure that you can find it there, and then let us know.
Thank you, Lucas. Next question. When can we expect the 2025 Limb Loss and Limb Difference Awareness Month Toolkit?
I am really excited to say that Limb Loss and Limb Difference Awareness Month being in April of every year means that this time we will be having the toolkit out in the month of January. So just about 2 months away.
Thank you, Shri. Oh. What is the AC doing to help prepare patients and clinicians for the next wave of emerging technologies in the O&P industry?
I'll take this one, and I will encourage those in the community who are a part of the O&P industry or field or profession to share their ideas about ways that you think we should be engaging individuals. But our first and foremost, we are concerned about access. We want to make sure that individuals have access to emerging technology. We want to be able to advocate for individuals to get the healthcare services and technology, orthotic and prosthetic technologies that they need to live fulfilled, engaged, functional, and mobile lives. And so we always look at access as our primary responsibility as an advocacy organization. But there are a lot of other ways that we want to engage the community with emerging technologies. And our conference, the exhibit hall at our conference, is an opportunity for individuals to experience those technologies in real time in ways that they might not be able to when they're in their prosthetist office and their prosthetist is trying to to guide them in the clinical, the most, clinical best practice, right? That creates a whole dynamic. But people can just explore what's out there, and that happens in our exhibit hall. So I would encourage, companies to continue to engage with the Amputee Coalition. We welcome other ideas, again, from those of you out there in the world who are innovating and bringing new technologies to the space.
Thank you, Ashlie. And we are going to have one more question before we wrap up. With the new administration and the plan to possibly prioritize Medicaid, how will the AC address these changes to government programs?
Cass, you want to take this one?
Yes, I will. The day after the election news, we were receiving questions. What about my health care? What will happen to me? What about my life? All the things. What we want to say from the Amputee Coalition is you're hearing from us tonight, whether it's the GA report, whether it's the policies that Ashley's talking about, everything is done from a bipartisan lens, and it's done from the needs of communities. So we will continue to support, to advocate for insurance fairness for all of the things that you've heard us talk about, regardless of the administration. and with supporters on both sides of the aisle. And that's the commitment moving forward. I would encourage all of you to stay engaged, because if there are changes, if there is anything threatened, if we need to join together, we will need you. So tune into our newsletters, tune into these town halls, stay engaged, and listen to what we're sharing and seeing. And we will let you know if we all need to rally around anything. But we stand committed, same as we were in October, before we came to this point, on all of the policies and advocacy things that we want to move forward. So that is our commitment. With that, I will put it back to you, Patrice, and Bill to close us out. Thank you.
Great. Thank you so much, Cass. Well said. And thank you everyone for your intentional questions, your participation. Thank you to our senior staff for your feedback and your questions to our audience. At this time, I'd like to hand it over for our winter town hall closing to the Amputee Coalition 2024 Board Chair, William Perno. Oh, Bill, yes, there we go. Perfect. Still muted.
Thank you, Patrice. Well, let me first say it's good to work with such a fabulous team. We have another opportunity that we close the books on tonight, a time of connection in our winter town hall. I'm so energized when I hear this team speak about our community and things that we're looking forward in 2025. It is a very, very exciting time of the year for us. So whether you're a member of the community or a partner, or a member of the board of directors, or a part of the dedicated Amputee Coalition staff, showing up is always important, and it's invaluable to our mission. I want to especially thank our president, CEO, Isidro, and our senior team members. Every day they work together at the coalition to bring our mission out front, alive, and a clear reality every day. Basically, today we are blessed to hear about the incredible mission work happening within our organization. It's the new resources that they've talked about. It's the program updates that you heard. Overall, my hope is that you're reminded of the progress we've made in the last year, and the progress we've made is together. And so much more we have coming in the future together. The Amputee Coalition Board of Directors and the entire staff are dedicated and committed to making sure that no one has to face their journey alone. Please stay connected with our team throughout all the contacts we've shared in the chat. Be safe, be well, and thank you for joining us this evening. Have a great week.